Welcome, everyone, and good evening. I'm Maurice Dubois.
And I'm Christine Johnson. Today marks 1 year since the first confirmed case of COVID-19 in New York City. Its devastating impact has been felt around the globe. More than 114 million cases worldwide and 2.5 million deaths.
28 million of those cases are from the United States, where more than 500,000 people have died. That is higher than the American death tolls for World War II, the Korean War, and the Vietnam War combined. In New York City, there are more than 600,000 confirmed cases and nearly 25,000 deaths. The city was one of the first places in the country to be hard hit. From March to May, it was the epicenter of the virus.
It was a devastating period that changed our city profoundly. CBS 2's Aundrea Cline-Thomas offers a glimpse of a year in the pandemic.
The first known COVID patient in our area was a 39-year-old healthcare worker who had recently returned from a trip overseas. She recovered at home. Medical professionals and politicians were prepared for that moment, but no one truly knew at the time what was in store.
We didn't go to any places, cooked food at home and everything. I mean, it was a very scary time, definitely.
I don't know how much more graphic you could be than to, like go past the hospital, neighborhood hospital here, Mount Sinai, and see the morgue tractor trailer.
By the time the first reported case of the coronavirus was identified in March of 2020.
I already knew that was coming. I already bought masks. All my family, I tell all my American friends. Nobody wanted to believe me.
The virus was already spreading unknowingly in the tri-state area.
We have told New Yorkers from the beginning, get ready, here it comes. We're going to all be able to deal with it together.
Calls for continuing life as usual while taking precautions lasted just days before schools, businesses, and iconic landmarks were closed, except for what was deemed essential. Weeks turned into months. Face coverings became the mandatory accessory, keeping our distance an urgent safety measure, and long-standing inequities could no longer be denied.
Since this thing happened, our job is totally done.
The economic fallout was immediate. Unemployment claims soared, and lines at food pantries wrapped around city blocks. Meanwhile, on the front lines of the fight,
it's like something out of the Twilight Zone, and I don't think any of us going through it will ever be the same.
COVID cases exploded. Hospitals were overwhelmed. Personal protective equipment in short supply, and families were left devastated. So far, 69,000 total COVID-related deaths have been reported in New York, New Jersey, and Connecticut. Still, in the midst of sorrow, glimmers of hope. Patients celebrated being discharged after long battles in the hospital. Neighbors helped each other and rallied around their local businesses, like the Thirsty Koala restaurant in Astoria, Queens.
We still sponsor meals to first responders and to, people in the emergency departments.
For those forced to pivot,
people really need comedy now more than ever.
Andy Engel, owner of the Manhattan Comedy School, transitioned his classes to Zoom.
Okay, you need to say that.
I feel like that's embarrassing.
And found an even deeper purpose.
They became a place to laugh, make others laugh, connect with 20 new friends safely, and more importantly, it became therapy.
The road to recovery has been marked with starts and stops. This year has not been easy, but we made it. There is hope, especially in the COVID vaccines. Many people say they don't want to just go back to normal, but create a new normal that implements everything we've learned during this difficult year. Aundrea Cline-Thomas, CBS 2 News.